My name is Dr. Frank Vicini. I'm a radiation oncologist for Genesis Care USA. I primarily treat breast cancer and have been involved in multiple studies looking at the treatment of breast cancer with radiation therapy. Over the past few years, I've had several cases of exceptional responders, but the one that comes to mind is a 34-year-old young woman, a lawyer, who palpated a lump in her breast while she was showering. She pointed it out to her physician, who referred her to a surgeon, and the surgeon palpated, felt a 4-centimeter mass in her left breast in the upper outer quadrant. She underwent imaging and then an MRI. Basically, they found about a 4.5-centimeter tumor in the breast. They went ahead and did a biopsy of the cancer, and it was estrogen receptor negative, progesterone receptor negative, and HER2 positive. They also saw lymph nodes that appeared to be involved with cancer, and one of them was biopsied and was also positive. So again, we had a young patient with premenopausal with a 4.5-centimeter tumor in her breast and what appeared to be positive lymph nodes in the axilla. And the cancer was estrogen, progesterone receptor negative, and HER2 positive, HER2 receptor positive. She underwent genetic testing. This was negative, and saw the medical oncologist and was started on systemic chemotherapy as well as Herceptin. Over the course of her chemotherapy, she was noted to have a good clinical response, and the tumor could no longer be palpated. Shortly after the completion of her systemic chemotherapy, she underwent a bilateral mastectomy with reconstruction, and the pathologic findings from the mastectomy on the left revealed no residual disease in the breast, and she had 7 lymph nodes removed, and they were all free of cancer. So this was an exceptionally good case in a patient that underwent a pathologic complete response, which we see more frequently because of the improved use of chemotherapy, targeted chemotherapy. Now, she will still require a regional nodal radiation therapy and will continue to receive Herceptin treatment over the course of almost a year, but nonetheless, she underwent a complete pathologic response and should have a much better prognosis because of that.